today. We'll be talking about today's healthcare, the issues with it, and a possible solution for many of us. As consumers, we're definitely familiar with the problem with today's healthcare. For those of us that don't get a subsidy or receive a very small one, it's going to be another tough open enrollment for us. Not only that, but half of the counties only have one option on the exchange. Here's a map of the U.S. As you can see, most of the nation only has one option to choose from, maybe two or three. So it really gives us little control over our healthcare. Most of us want to have a PPO. We enjoy the flexibility in it. The areas that do have a PPO available are extremely expensive. Healthier and middle income individuals continue to subsidize the premiums for the lower income and the unhealthy. 6% of the folks that are enrolled in the ACA account for over 80% of the claims paid. Not only that, but 70% of the invincibles, those that are 18 to 34, 70% of them don't even get insurance. Biggest reason being it just costs too much. But it's still so important for us to have. 60% of bankruptcies nationally are healthcare bill related. And the shocking part is that 3/4 of them had health insurance in place when they got sick. They just didn't have the right coverage. Healthcare premiums are continuing to skyrocket too. This year, the average national increase was over 17%. For the first time, the middle class is going without health insurance just because they can't afford it. So what are your options when you need healthcare coverage? Well, first you have the ACA, group or work plans, Medicare, Medicaid, but you have to qualify for those, based on your income, based on starting a new job, or if it's in that open enrollment period. So there's a limited enrollment, and if you don't qualify for a subsidy, they are extremely expensive. Not only that, but they generally have a very small network. As we've seen over the past years, fewer and fewer doctors are accepting these types of plans. The good thing, though, is that they cover pretty much everything. So it really gives clients low risk in that aspect. Your next choice would be a short-term plan, a limited medical plan, or a discount plan. The good things about these plans is that they're generally pretty cheap. They have an open enrollment, you can get them year-round, and they're a pretty large network. Most people seem to accept them. But the issue is that they have limited amounts that they'll pay for certain services. You're probably good with the flu or the sniffles, but if something catastrophic happens, which is why we all really get insurance, they have caps on how much they'll pay out. So it really gives consumers a lot of risk, and sometimes it's a one-way ticket to bankruptcy. Your third option is a healthcare sharing ministry. It's an open enrollment, meaning you can get it year-round. You don't have to just get it in November. And compared to the Affordable Care Act, it's extremely affordable. Not only that, but most of them have a very large nationwide network, so you can use it out of state. And it gives people a lot of different options. The plans have a religious aspect to the plan, so they're able to get around all the rules and regulations of the ACA. So now you're able to kind of customize your plan based on what your needs are again. If you're a 60-year-old female or a 20-year-old male, you don't have to have maternity coverage on your plan. You don't have to have a plan that covers all pre-existing conditions. So you're finally able to get coverage that not only fits your needs, but also your budget as well. So it really gives us low risk in what we're looking for. So the solution for many of us could be health sharing. On average, healthcare sharing ministries save families over $20,000 a year. So what is a healthcare sharing ministry? Well, it facilitates costs among individual members of a specific group. They have to share common ethical, moral, religious, or spiritual beliefs. They give many people the choice and flexibility in coverage, allowing them to find an affordable solution to their healthcare. Now, I'll say it over and over again, they are not the right fit for everyone, but for those of us that are overpaying for our insurance or underusing it, these plans make complete sense in today's market. The biggest difference between traditional health insurance and your healthcare sharing ministry is the terminology. Since it's an alternative to the ACA, they're not able to use insurance terms. As silly as it is, they can't say deductible. It's an MSRA. It's the amount the member pays before a healthcare sharing ministry starts picking up the tab. So it literally means deductible. Just like that second one there. Consult fee. That's the amount the member pays when they go to see the doctor. Sure sounds a lot like a copay. Just like that third one there. They don't join an insurance plan, they join a membership. So it's important to remember that. Because they're an alternative to the ACA, as silly as it is, they just can't use insurance terminology. It's not a deductible, it's an MSRA. It's not a copay, it's a consult fee. Just like it's not insurance, it's a membership. So when you get that brochure, when you get that policy and you see this is not insurance, you understand why. It goes on and on. You know, it's not co-insurance, it's co-expense. It's not a doctor, it's a provider. So why are they inexpensive compared to traditional marketplace insurance? Well, they're nonprofits, so a lot of times they get lower negotiated costs. And there's no subsidies. So everyone is on the same playing field. Biggest difference though, is that members are not subsidizing lifestyle choices that others make. Basically meaning pre-existing conditions. Okay, so these plans are going to look and feel a lot like how health insurance did before the Affordable Care Act. And because of that, members have generally committed to living a healthy, more honorable lifestyle. But because of the different pre-existing weights and restrictions, healthcare sharing ministries are not for everyone. But who are they perfect for? Well, obviously you're non-subsidy eligible. You know, if you don't qualify for a subsidy or qualify for a very small subsidy, health insurance can be extremely expensive. So obviously those that don't qualify for a subsidy, these plans make sense. Or you're healthy people. You know, if you're healthy or if you don't have any pre-existing conditions, doesn't really matter too much if your plan doesn't cover pre-existing conditions. You know, these plans would make sense for you. Not only that, but if you miss open enrollment, you know, if it's outside of November 1st to December 15th and you need coverage, this is going to be the perfect solution. Or if you did get a plan during open enrollment and it comes February and you don't like the plan or your doctor doesn't take it, you can't switch. Now you have somewhere to go. So anyone that's unhappy with their plan or if they want to change plans, or people that want access to that PPO network. You know, like if you live in Michigan but spend half the year in Florida, now you have coverage in both places. If you're a college student and go to college out of state, now you have coverage in both places. People that travel or want nationwide coverage, truck drivers, basically anyone that leaves their state, now they have coverage in both places. Not only that, but you don't have to re-enroll every year. You know, you don't have to call your agent every November to find out what your rate's going to go up to. You don't have to call them to see if your doctor is still going to be in network. Now you get something that's going to stick with you and keep rolling. Another place where this makes a lot of sense is for the folks that are aging into Medicare. It happens a lot of times where the husband will turn 65. Meanwhile, his healthy 62-year-old wife just lost her subsidy because now he's on Medicare. So now her Anthem plan went up to $1,500 a month. Now you have a good, viable solution for her. Or for those of us that don't have a social security number yet, you know, we might have a TIN number. Now there's an actual good solution for us. Or for those of us that don't want to have to prove our residency, or for self-employed people that have a tough time proving income, this is a good solution because they're not even going to ask for that. Or basically anyone that is fed up with the healthcare system and or insurance companies. It's been a rough few years for those of us watching our premiums skyrocket. So now we can finally find something that's going to be in our budget and fit our needs. Now there's a variety of companies that offer healthcare sharing ministries. They definitely all have their own fit. There's 6 big ones. You have Alira, Medi-Share, Altrua, Liberty, Samaritan, as well as Christian Healthcare Ministries. The big 3 are Alira, Medi-Share, and Altrua. So based on what you're looking for in the plan, you can kind of figure out which company would be the best fit for you. But 9 times out of 10, it usually seems that Alira makes the most sense for folks. Alira really focuses on preventative care. They really focus on making sure they welcome all individuals in there as long as they agree with their statement of beliefs. Not only that, but they're extremely affordable. As you can see with a little comparison just among the big three, usually Alera makes the most sense for the clients. So if this is already sparking some interest, if this is something you think might be good for you and or your family, talk to an expert. Give Jermaine a call. Jermaine has been an expert in this field for years now, and he can really direct you in the right place and answer any questions you may have. But let's go further in depth about Alera. Okay, again, Alera is one of the 6 main companies offering healthcare sharing ministries. And what separates them? Well, they operate on a statement of beliefs, not of ethics or faith. And they are open to people of any religion as long as they agree with that statement of beliefs. It's offered in 41 states, every state except for Wyoming, Montana, the Dakotas, Vermont, Maryland, Maine, Alaska, and Hawaii. But the biggest reason what I really love about Alera is that it operates almost identical to your traditional health insurance in the aspect that providers are paid from an escrow account, not member to member. So that means that your client takes his Alera card to the doctor or to the hospital. That doctor bills Alera, and Alera pays the doctor, just like traditional health insurance. A lot of the other plans are indemnity plans, meaning you go in as a cash pay patient, you pay the doctor, and then eventually Medishare will pay you back. Meanwhile, your credit card is racking up interest. So it seems like most consumers really enjoy Alera because that's what they're used to. That's what they're familiar with. Not only that, but there's no upfront health requirements. Alera is also the only healthcare sharing ministry out there that's open to same-sex marriages, and they really focus the majority of their plans on preventative care, because obviously how important that is. Every single one of the healthcare sharing ministry companies has a statement that the consumer must agree with. Some of them are really in-depth. Here's Alera's. Number 1, you believe in God. Number 2, you think it's everyone's right to worship God in their own way. Number 3, try to help out your fellow man when you can. Number 4, you try to lead a healthy lifestyle. And number 5, you think it's everyone's right to direct their own health care. If you can say, yes, I agree with those 5 statements, you're good to go. I don't know many people that can agree with those 5 statements. Okay. The other companies, like I said, they're quite a bit more in depth, where you have to agree that marriage is between a man and a woman. You have to agree that there's no sex before marriage. Whereas Alera, they're quite a bit more welcoming on who they allow in and what you're able to do on the plan. So again, if you're able to say yes to those 5 statements, you are good to go. So now again, Alera is one of the 6 companies offering healthcare sharing ministries, and they have 4 plans. Okay, one of the companies, and they have 4 different plans. Your first option is Primacare. Primacare is your first dollar benefits. Your preventative care, your doctor visits, your urgent care visits, your prescription coverage, okay, but no hospitalization. Then you have the flip side, Care Plus Advantage, your true catastrophic plan, only covers hospitalization, okay? So perfect for the guy who only wants insurance or coverage in case he breaks his leg. Perfect for the guy just in case he has a heart attack. Only covers hospitalization. And then you have Alera Care, the best of both worlds. Combines the 2 of them. You're getting your first dollar benefits and you're getting your hospitalization. Okay. They also have short-term coverage, in case you need something for just a month or 2. And they also have dental and vision. Okay. So first we'll talk about Primacare. Primacare, again, is your first dollar benefits. Primacare works on the First Health PPO network, an extremely large nationwide network, and it gives you all of your first dollar benefits. So you're getting the 63 preventative screenings that are required by the ACA once a year, everyone in the family. You're getting telemedicine. Telemedicine is incredible. 80% of the reasons why someone would go to a primary care physician, a telemedicine doctor can solve it. 24/7, 365, you have access to a board-certified doctor that you can call, video time, FaceTime. They can write you prescription refills. They can call in an antibiotic for you. They can look at the spot on your arm and call you an ointment. I mean, we all know when we have the flu. We all know when we need a Z-Pack. So now you don't have to take time off work. You don't have to drag the kids out of school. You don't have to go sit in the waiting room for 2 hours. You can get it done right over the phone. Telemedicine is incredible. Not only that, but you also get primary care visits. So based on whether you get the traditional plan or the premium plan, you get primary care visits at a $25 copay or consult fee, as they call it in the healthcare sharing world. And you're also getting urgent care visits. You're getting pediatricians, OBGYN visits, and prescription coverage. And as you can see, it is extremely affordable. A lot of times too, what some consumers will do is they'll couple this with a bronze plan. So they may have some conditions, so they want to have an ACA plan, but they've been seeing the same doctor for the past 20 years, and now their doctor's out of network. So instead of having to switch doctors or PCPs or OBGYNs, now they can get this in addition to a bronze plan, and they're actually able to keep their doctors that they had. So as you can see, this is a great solution if that's what you're looking for. So let's talk about the other plans. CarePlus Advantage and AleraCare, they both work on the multi-plan PHCS PPO network. It is the largest nationwide network. They have over 1 million doctors, and they have 18 of the top 20 best hospitals in the nation, including the Mayo and Cleveland clinics. So let's talk about CarePlus Advantage. CarePlus Advantage, again, is your true catastrophic plan. Only covers hospitalization. It does also include your telemedicine, and it does also include a prescription discount card. You have 3 different sharing limits, meaning per incident limits of 150, 250, and 500,000. And then you have 2 different deductibles, or MSRAs, as they call them in the healthcare sharing world, of 5,000 or 10,000. That is it. That is your what they call maximum out of pocket. So if you had a heart attack, for example, or broke your hip, you would have either a 5,000 deductible or MSRA, or 10,000 deductible MSRA, and that would be it. And then they would cover that. So as you can see, perfect for the person who just wants it in case he breaks his leg. Perfect for the person who just wants it in case he has a heart attack. For many of us, these plans are what we need. I think out of the past decade of having health insurance, the only time I've even used mine once is when I broke my foot. This plan would have picked it and probably saved me tens of thousands of dollars compared to all the benefits I've had for the past decade I didn't really need. This is why we all get insurance. We don't get car insurance for popped tires or windshield wipers. We get car insurance in case we total the car. Same thing with health insurance. And as you can see, it is extremely affordable. So you essentially have 6 different options, 3 different per incident limits, and then 2 different deductibles. So as you can see, you could get a 58-year-old male quality coverage for $130 a month. If you put on some accident coverage or critical illness insurance, meaning that if you had an accident or you had a critical illness like a heart attack, it would pay that $10,000 for you as well, and you'd probably be well under $200. So as you can see, this might be what a lot of us are looking for. But let's look at AleraCare as well. AleraCare is the best of both worlds. It combines the 2 of them. Okay. AleraCare has 6 different levels. They have a value, plus, and premium, and then they have a bronze, silver, and gold. And it goes up in benefits. Value having the least amount of benefits, and gold having the most amount of benefits. Out of all 6 levels, by far my personal favorite is AleraCare Premium. I think dollar for dollar, you really get the best coverage with AleraCare Premium, especially for families and especially for women. Let's talk about AleraCare Premium. On the left-hand side there, these are all your first dollar benefits. Preventative services for everyone in the family. Everyone in the family gets the preventative services covered once a year. Everyone in the family also gets that telemedicine doctor. Everyone in the family also gets 5 sick visits a year at a $20 consult fee. So if someone has the flu, you go in, you pay $20 and you're done. Not only that, but that's an all-inclusive copay, consult fee. Meaning that if that doctor has an x-ray machine in his office, that x-ray is covered with that $20 consult fee as well. Not only that, but you get 2 urgent care visits and a prescription discount card. So everyone in the family is getting 5 sick visits, 2 urgent care visits, and a preventative visit. That's 8 visits a year. Even if you did go more than that, you could. You would just pay the network rate, the PHCS network rate for that office visit. So it's incredible. Not only that, but kids can select a pediatrician as a PCP, meaning kids could go see a pediatrician for every single one of their sick visits if they wanted to. And that's all first dollar benefits. Has nothing to do with deductibles, or MSRAs as they call them. It has nothing to do with pre-existing conditions. Okay, so let's talk about the right side, the hospitalization side of things. You get your inpatient, outpatient surgery, your hospitalization, and then those are your deductible levels. Again, MSRAs, as they call them in the healthcare sharing world. $5,000, $7,500, or $10,000. That is it. That is your maximum out of pocket per person. So already these plans are better than bronze plans. Bronze plans this year on the Affordable Care Act have a maximum out of pocket of $7,900. So already 2 out of the 3 of those plans are better than the ACA. Not only that, but you get a true $300 emergency room consult fee. Meaning if your son goes to the emergency room, gets hit with baseball at the ball game, has to go and get some stitches, he has a $300 consult fee and he's done. If he gets admitted into the hospital, that's where he'd fall subject to the full MSRA. But you just have that $300 consult fee if he doesn't. Another big reason why I like the premium plan is that you're at $500,000 per incident, and you have $1 million lifetime max. So if you remember back to before the Affordable Care Act, these plans are a lot like those plans, where they had that $1 million lifetime max. They had different pre-existing restrictions. Not only that, but on premium, you're also getting a $75 consult fee for specialists after your MSRA, and you're also getting maternity coverage. So as you can see, this plan is really all-encompassing. This is what most folks would be looking for, especially for families and especially for women. So let's talk about pre-existing conditions. You'll notice the asterisks on the right side of things, the Trinity offering of the plan. There's a 24-month wait on pre-existing conditions, but it's only the right side of things, only the hospitalization side of things. Okay, so I'll say that again. If you have a pre-existing condition, like diabetes, for example, there's a 24-month wait on services only on the right side of things. So anything related to diabetes would have a 24-month wait, but again, that's only on the right side of things. So let's go a little bit more in depth. Let's talk about a diabetic taking metformin, for example, just the pills. He could immediately still go use preventative services. He could immediately still use telemedicine to get his metformin refilled. He could immediately still go to PCP to get his A1C checked. He could immediately still go to urgent care if he needed to. But if he had a diabetic coma or needed an endocrinologist to see a specialist, that would have the 2-year wait. Okay. So a diabetic taking metformin should feel comfortable getting this plan all day, because they're probably not going to go into a coma or need to have a foot removed. But a diabetic taking high levels of insulin that's extremely overweight, this plan's not going to be the right fit for them. They're going to need to stay with their Affordable Care Act plan. So that's your 30% of consumers that these plans don't make sense for. But the 70% of us that are underusing and overpaying for our insurance, these plans make complete sense for. So if you're taking metformin, or if you just have cholesterol, or if you don't have any pre-existing conditions, these plans make complete sense for. But if you have an extremely expensive condition or have to go through ongoing expensive treatment, these plans don't make sense for you. You need to stay where you are. But again, if you just take a really cheap generic medication, or you don't have any medications, finally we have an option where we can kind of customize the plan to what we need. And it's extremely affordable. Like I said, I love the premium plan, especially for families and especially for women, because you get that maternity, you get the specialist, you get all those visits. But like I said, if you're a 60-year-old female or a 20-year-old male, you might not need the maternity and the specialist visits. So a value or a plus plan might be just fine. And as you can see, they are extremely affordable compared to the ACA. Like you could be a couple in your 50s and get a premium plan, and you'd be anywhere from, $500 to $600 a month, compared to where in the ACA you'd probably be closer to $2,000. So as you can see, there's lots of different options to choose from, and there's even a bronze, silver, and gold above this. So talk to an expert. Give Jermaine a call, go more in depth about the plans, figure out what makes sense for you and your family, and it's finally time to choose your coverage again and start saving thousands. So thank you for joining us. I hope this helped a lot, and please do reach out to Jermaine. That way he can help you make sure that you and your family are in the right fit. Thanks. Have a great day.